Let's hear from the counties because, Governor, you lead a county and devolution has been on for more than 10 years now. Health is basically quite devolved, apart from the policy direction that may come from the ministry. But what would you say is the true picture on the ground? You can start with your county specifically, but also the bigger picture across the counties when it comes to the diagnostic capacity. Yes, we hear of screening, that you want that the health workers are as suspicious as possible. But what is the capacity that you'd speak of?
Thank you very much. And allow me actually not to start with the counties. Allow me to start with myself. Because I would be like to speak to the Kenyans that when we talk about cancer, it's a national conversation that affects anybody in this country. It is not for the poor, it's not for the rich, it's not for those who are ignorant. I say start with myself because I always give this story. My father was a nurse, and even as he was treating other people, he developed a pimple on the neck. And I remember him saying, when I was a small boy, that I do not want to go to hospital in Nairobi because I don't want to be found with cancer. You know, that kind of attitude. And eventually, that pimple developed to something else. And to cut the long story short, my father eventually got cancer that affected his ears and I think TNC. We spent a lot of money here on, and at that time we did not have advancement in chemotherapy. Mostly we used radiotherapy. And eventually we lost him. And I remember saying to myself, never again. Because had we taken our dad to hospital in good time, probably early detection would have saved him. I said never again. But 28 years later, when my mother was diagnosed with a stomach problem that we took to several specialists in stomach, and eventually she was diagnosed with stage 4 of pancreatic cancer, which the doctors tells me is usually very hidden. It is the one that actually kills Steve Jobs of Apple, and with all the money that he had. It means that the attitude, even out there, because I've had one patient there saying that there's usually stigma among our patients. When somebody is told you have cancer in Kenya today, first thing that comes to their mind that there's a possibility that I'll go. Why is this the case? As I talk about the counties, if you look at the global picture of cancer, the whole world, 70% that is killing people is happening in middle-income countries and low-income countries. Do we have bodies that are different from the first world countries? Of course not. There must be something that they're doing that is different from what we're doing that is making them not see cancer as a threat, because almost 95% of their patients recover. And that is what we need to address. And it basically boils down to the issue of the cost of almost every stage of cancer, be it diagnosis, be it screening, all the way to the treatment in this country. Right. We must address the issue of the cost, access to this treatment, and even their diagnosis. In the counties at the moment, we have only 10 cancer centers in the whole of Kenya, in actually 10 counties at the moment. We were in the process, I think, of increasing with another 4. I'm not very sure that it's been done. But that tells you that not every county can be able to do diagnosis, screening, to the level that they go to treatment without having to move to a neighboring county.
So the cancer centers are for basically treatment?
They are basically for treatment.
But what is the capacity for diagnostics?
The capacity for diagnosis, from the level 3, it is possible to do simple diagnosis like pap smear. They are also able to do VIA. We are able to do mammogram in level 4. We are able to do also, we are able to use CT scan probably for those who have radiologists. However, there are counties that do not have the personnel to be able to...
Can you be specific? Tell me the story of your county.
Yes.
Are you able to screen and tell people this is what you're suffering from? Or it has to be somewhere else? Well,
I have to be factual. Up to some extent, we do clearing and forwarding. In terms of, we do not have the capacity because our county does not have MRI. If we need something that needs to have a scan with MRI, we have to send to Nairobi. CT scan is possible. But again, it is not every radiographer or and radiologist who is able to detect cancer. Okay. We need an oncologist radiologist.
So Nairobi is your nearest?
Nairobi is our nearest. Okay. And just to make it very clear, in the counties, when you look at the number of oncologists in the whole country, in the issue of HRH, the number of nurses who have done radiography, you might find that in a county, you might find only one or maybe two. You may find there's no such doctor in such a county. And therefore, and it's not because counties don't want to employ. You advertise and you don't get anything.
Okay.
Last time I checked with the